Hello everyone. Today we will be talking about the really riveting subject of federal regulations. Please contain your excitement. In all seriousness, we all have questions about who is regulating all the important aspects of our lives, especially in the healthcare arena. What exactly is federal regulation? It is one of the tools that our government here in America uses to carry out public policy. Agencies create regulations or rules when Congress provides them with the authority to do so. Over the years, there have been many regulations that did not make it past Congress. When it comes to regulations, it is important to remember that for every action or rule that is made, there is a subsequent reaction and at times an outcry to the new rule. It can take many years for regulations to pass, and at times this causes confusion and frustration. Cue Obamacare. Some of the most recently talked about healthcare regulations are ones that are covered by HIPAA, the Patient Protection and Affordable Care Act, the Healthcare and Education Reconciliation Act, and the Healthcare Quality Improvement Act. Obviously, I have these listed by the most encompassing and relevant acts. I have placed PPACA second simply due to the overwhelming amount of information that is still unclear and unknown by most average citizens. HIPAA is an everyday word, and by now most people know what it is, what it covers, and how to protect themselves or to ensure protection via privacy. HIPAA was a very ambitious attempt by Congress to reform the American healthcare system. It allows for continuous coverage of insurance when employees move from one employer to another. It has and continues to improve the efficiency of the healthcare system. It has helped to reduce healthcare fraud in many ways as well. This has allowed the government to track, convict wrongdoers, and regain lost funds due to fraud over the past 10 years especially. HIPAA has also helped in facilitating health information tracking by implementing reporting systems through regulations and tracking accuracy through audits. When most of us think of HIPAA, we think of one thing only though, and that is the privacy and protection of our Covered entities include laboratories, dental practices, nursing homes, hospitals, hospices, pharmacies, physician practices, chiropractors, podiatrists, physical therapists, osteopaths, alternative medicine practitioners, health plans or payers, and healthcare clearinghouses. Also, people, businesses, or agencies must comply with the standards of privacy. If even one exchange is made by electronic means by a healthcare practice, then that practice is a covered entity regardless of how small the practice actually is. The Patient Protection and Affordable Care Act stemmed from promises made by President Barack Obama during his election campaign. The regulations are to be implemented over the course of 8 years total, but we will see about that considering all the controversies surrounding this right now. We will go over the short version of the intention of the regulations included in this act that are to expand the eligibility of Medicaid by raising the income level that meets the requirement of eligibility, establishing state-run health insurance exchanges, expanding medical research, especially in genetics, and restricting insurance companies from using pre-existing conditions against people, especially children. Also included in the regulations are topics such as insurance coverage. It cannot be denied due to mistakes that people have made while filling out their applications. Insurance companies cannot set maximum lifetime benefits on policyholders. Premiums cannot be raised past set limits, and provisions will be paid for by increased taxes and fines placed on those who do not participate. Major provisions are temporary high-risk pools, pre-existing conditions, adult children, coverage limits, tanning salons, preventative care, Medicare recipients, and tax credit for businesses. The major provisions that are effective right now in 2014 are the health insurance exchanges, in which cause the effect of state-run healthcare exchanges for uninsured individuals and small businesses were created. Individual mandates cause the effect in which everyone must have health insurance or pay a fine each year when you file your taxes. Yay! Companies with 50 or more employees will pay a fine if any of their full-time workers qualified for federal subsidies. Medicaid expansion has increased the eligibility for those under the age of 65. Federal subsidies will help lower-income people buy insurance. Last but not least, annual insurance company fees are imposed on health insurance companies. The HCERA is basically an addition to the PPACA. It includes additions to the regulations that are already in place and places a fee on drug manufacturers as well. The last regulation excises a tax on high-cost insurance plans. The HCQIA, in my opinion, was the precursor to all of the previously mentioned regulations in this video. It was enacted to improve the quality of medical care in areas that were nationwide issues. It required peer review action and limits damages for professional review. It also acts to protect those who provide information for these reviews. In my opinion, the most important thing that this act did was create the National Practitioner Data Bank. All of the changes that we have seen in recent history seem to have started with the HCQIA. So in layman's terms, what does all of this mean for all of us? What does this all mean for the healthcare provider? What does this mean as a nation? Who is being targeted, and is it in a good way or a bad way? First of all, it means that the average American can receive health care, especially those who fall under specific low income levels. Secondly, it means that health care providers have more protection and less risk with providing care to those with previous conditions that were before listed as pre-existing. Last, as a nation, taxes will increase. There is still no hope of universal care on our horizon. Wouldn't that be nice? And the unknown still continues to drive political debates. Pointing fingers is what we do when there is a problem. Pointing fingers is what we do when asked who is in charge. In this case, it is cumbersome to keep up with who is in charge of what. Almost every single area of healthcare is overlooked by someone or some entity. It is mostly driven by forces that are all competing to have their interests represented. Different government levels, such as federal, state, and local, control different areas and levels of healthcare. Private organizations are often the ones in control of these regulations as well. Altogether, the healthcare system is due to benefits from different levels of government regulations and agencies. Having all of these different government agencies and private organizations in charge is not without its repercussions. Ever hear of the phrase, too many hands in the cookie jar? Yeah, it's kind of like that. And that sums up our healthcare system in America. Private regulatory bodies seemed focused only on their own concerns and protecting their specific area of interest. State regulators are heavily influenced by those who are supposed to oversee these regulations. I am not by any way, shape, or form suggesting that anyone in any political position would ever abuse their power by allowing influences from other sources. No, never. Not me. Federal agencies can be slow, bogged down by bureaucracy, and at times highly inefficient and redundant due to overlapping levels of government trying to handle the same things at once without working together. Basically, the division of authority is simply not clearly outlined in some cases, and confusion settles in, and it can take an eternity to sort out the issues. Currently, the regulations in place are changing again and will continue to change as we adapt to new technology and try to increase patient access and protect patient information. Isn't the goal to give access to as many people possible while making healthcare more affordable for the majority of the people? Mergers of healthcare industries are happening in record-breaking numbers over the past 2 years. Technology and policies, especially meaningful use, are forcing changes, training, and adding costs without yet showing the full financial benefit to the providers, but they are increasing patient awareness. Movement towards a retail-style system is in the near future as well. Basically, this means that hopefully the supply will meet the demand while still maintaining a high quality of care. Acquisitions of smaller practices are taking place most likely as we speak. Cost of implementing the software to meet the regulations forcing smaller practices to join with larger hospitals and medical groups. Hopefully in the future there will be more funding and focus on research as well. Upon researching for this project, it became clear to me that reading about federal regulations was one thing. Talking to someone who deals with them 7 days a week for a living was a completely different thing. I thought it would be a good idea to get the perspective from someone in this position, so I interviewed my friend Dr. Victor Ortega. I was actually surprised by the amount of information that he was able to give me that was both positive and negative. I was also pleasantly surprised to hear that he thinks that the regulations in place as far as the EHR go will cause a high demand for those in my field of healthcare business informatics. When I asked him how these regulations have affected his everyday work environment, he said that with his position it has gravely affected his COPD patients, as the way the billing is now, it is almost impossible for a patient to be seen more than once and still have it covered. On a personal level, he stated that the immediate effect has been the cuts and losses of employees that his facility has seen due to the bad rollout of Epic, and all of the repercussions they have seen in the past year and a half due to the mistakes that were made. His research has been cut dramatically due to the subsidies being cut to the NIH, and it is making it incredibly difficult for researchers to do their work and gain funding despite what the public was told about the PPACA and its focus on research. The financial impact of not receiving reimbursements has been detrimental for his facility. Cuts are being made and almost $180 million has been lost, and most likely the reimbursements will never cover the cost of implementing meaningful use. However, he stated that meaningful use is the main area of promise in all of the regulations that are in place right now. In his personal opinion, the most impactful regulations are HIPAA as a whole and meaningful use. The conversation that we had lasted almost 40 minutes, and I gained an immense amount of knowledge in a short period of time about regulations in the healthcare industry. I really appreciate his spending part of his very valuable free time to talk to me. In summary, federal regulations have been changing and adapting since the AMA first came into play. With each new day, there's new technology and new regulations trying to be passed. The goal is to ensure that more people have access to quality, affordable care, protection of their rights are in place, protection of their privacy are in place, fraud is cut down, costs are kept at minimum levels, and people are educated enough to understand that voting is the first step to anyone's personal opinion about any regulation being heard. We can all complain about what is happening, but do we really have the right to complain if we didn't exercise our right to vote in the first place? No, I don't think so. The following are the sources that I used during the research phase of this project. I hope everyone has a great day, and I hope this may have helped you to understand a little better what is happening around you in the healthcare industry through all of the regulations that are in place. Goodbye.